Hello, everyone. I have the distinct pleasure today to speak with Professor Dr. Marshall Lichtman, who's professor of medicine, biochemistry, and biophysics at the University of Rochester School of Medicine and Dentistry. Dr. Lichtman is also a former dean at the University of Rochester, and certainly an eminent hematologist. By way of introduction, I'm David Bushinsky. I'm the John J. Kuiper Distinguished Professor of Medicine at the University of Rochester School of Medicine and Dentistry. I also have appointments in physiology and pharmacology and run the nephrology division. So now back to Dr. Lichtman. Marshall, if I may call you that.
We've been friends for a long time.
For a long time, yes. Can you tell us a little bit about growing up, where you grew up, your family, your upbringing?
Yes. My mother was born and grew up in Buffalo, New York, and my father in New York City. Each of their parents emigrated from Eastern Europe and became fairly successful after arriving here. So they were deep into middle-class life. And my father went to Buffalo to dental school. This was in the 1920s. And there he met my mother, who lived in Buffalo. And after they married and he finished school, they returned to New York City, which is my father's home. And I was born in New York.
All right.
And my childhood, I sort of think of in three phases. One is the New York phase, then the World War II phase, and then the Buffalo phase. And so I was born in New York City, and my parents lived in the South Bronx, which was at a time, and my grandparents, which at the time was a very nice middle-class environment, just off the Grand Concourse.
Of course.
A few blocks from Yankee Stadium. And it was quite idyllic, really, in many ways. And I had many friends. We didn't have television. And we spent a lot of time outside playing. And, of course, we became very loyal Yankee fans because we were in the shadow of Yankee Stadium. And, of course, because of the feature known as infantile amnesia, one doesn't remember much about the first 5 years of life. But I remember the beginning of the Second World War. My father went into the Air Force, and all my uncles went into the service. They were in the artillery, one was in the Navy, and so forth. And so a lot of my activities were dictated by the war. First of all, my father was moving around from base to base, and I went to about 6 public schools during 1942 to 1945 throughout the country. And I didn't find that really leaving any kind of imprint on me. That was what we had to do, and we did it. And in school, we had air raid drills. We knitted Afghan patches, which our teachers sewed together to provide blankets for the troops. We spent a lot of time going around collecting newspapers for recycling purposes and other things. The fat off cooking collected in cans, which was recycled for specific purposes. And every morning in the paper there would be maps showing the progress of our troops in the European or Pacific theater. The movies began to reflect that. Pictures about Guadalcanal Diary and Back to Bataan and the sands of Iwo Jima and so forth. So that period of my life was really consumed by gasoline rationing and other things, by the impact of the war. My grandfather was an air raid warden. We had air raid drills in school and so forth. Even though we were protected by the oceans, there was some concern that someone would get close enough to do damage. And then the third phase was when, after the war, my parents decided to resettle in Buffalo, New York, and my father restarted his practice there, and I went to later grade school and high school there.
Marshall, that's very interesting. How did you become interested in science?
You know, that's a difficult question for me to answer. I've read sociologist discussions of why scientists choose that path, and they say it's frequently people who like to solve puzzles, and there are other reasons that they argue that people go into science. I'm not sure. I think part of the reason was that first of all, we didn't have a lot of toys and things when we were children. There just weren't that many things. A lot of things we had to do ourselves. And so I spent a lot of time building erector sets, which might have led one to engineering, and also chemistry sets. And the other thing is I had some very charismatic science teachers in high school. I remember especially my chemistry and physics teacher, biology teacher, were very charismatic, and I found that very interesting.
So you chose science over engineering. For what reasons?
Well, I actually had an uncle who was an engineer, and I just seemed to gravitate more to biology than to engineering.
Any reason biology over physics or math?
I wasn't smart enough for physics or math. You know, I just read the biography of John Feynman, written by Gleick, and it's a very fascinating read, but I have to admit I understood about 25% of it, the sociologic aspects, but when they got into particle physics, the conceptualization of some of those things was just amazing.
And sometimes you can understand it after the fact, but to have come up with it
exactly.
is quite interesting. So you gravitated toward biology. And what was your academic training? How did you prepare yourself for a career in biology and in science?
Well, when I went to Cornell after I finished high school, and there I majored in zoology, which is what biology was called in those days. And it was a very rigorous experience because there were very long laboratories connected with each course. There were the lectures, of course, and so we would go to school 5.5 days a week because we had to take our laboratories on Monday, Wednesday, Friday, and Tuesday, Thursday, Saturday to match whatever the courses we were taking. General chemistry, organic chemistry. We had, in sophomore year, we had quantitative and qualitative analysis, which were very difficult courses at Cornell, but all of these courses had a lot of laboratory associated with them. In fact, quantitative and qualitative chemistry was almost all figuring out unknowns that we were given. And I took physiology, and I was a TA in comparative anatomy, where we did a lot of dissection of various species, and that was I just found that very, very interesting.
Now you had to choose. You knew you were emphasizing biology, but you really had to choose a path.
I did.
Your father was a dentist, so you saw what a practitioner could do, a dentist or a doctor, but you also could take the other path of being more of an academic researcher. And how did you make that decision?
I'm not sure I can recapture that. It may have been that the opportunities for scientists were not quite what they are today. I mean, obviously, if you wanted to go into teaching, that would be a natural path. The other was that my father went into dentistry at a time where there was more you could do as a dentist than you could as a physician in the 1920s. But I had contact with physicians. I had to have surgery as a youngster, We in those days pediatricians came to the house, and
Right.
my mother gave them coffee and
Sure.
snacks after they finished deciding that I had a cold or whatever.
Right.
And so I guess it was that. And the other thing was, at Cornell, a lot of my friends were going into medicine too,
Right. So
which
you,
was probably an influence.
so you chose medicine.
I did.
Where? And tell us about that experience.
Well, I went to medical school at the University of Buffalo, which was where
Sure.
our home. And Buffalo was sort of it was a private school at that time. It's now a State University of New York school. And Buffalo was sort of being rejuvenated, and they'd gotten a very distinguished physiologist to chair physiology, Fenn,
Right.
famous
Sure.
for working here with, I'm sorry, Ron was the
Okay.
new chair at Buffalo, working with Fenn.
Okay.
Here, the famous Fenn-Ron diagram of
Sure.
thoracic compliance and so forth. And they had a new chair of pharmacology from Harvard, and it was a very interesting experience. One of the other things about medical school is, again, we had a lot of laboratory experience.
Sure.
In biochemistry, physiology, we did a lot of dog experiments in those days. Anatomy. So by the time I got into medical school, I felt comfortable in the laboratory.
Right.
And PhD programs or MD PhD programs had not really developed in those days. The basic science departments were very small, and they saw themselves as their primary mission in some ways was training the next generation of physicians, and not so much in science, although some of them were excellent scientists, obviously, and very productive.
So you went to medical school, and what influenced you to become more of a researcher than a practicing clinician?
I don't know. I just decided I want to combine research with medicine, with the practice of medicine. And as a freshman, I became very interested in salt and water balance and a newly discovered hormone, an adrenocortical hormone, aldosterone, had just been described in the mid to the late 50s by Swiss and English scientists. And my freshman year, I decided that summer I want to spend my time setting up an assay for aldosterone.
Really? And did you do that?
Well, I spent the summer working on it and thought I was making progress, and then two endocrinologists published a double isotope assay for aldosterone, and that put me out of business temporarily.
Okay. This happens in science, of course. So after medical school, what training did you undertake?
Well, in medical school, apropos of my interest in aldosterone, I asked around who I could work with, who was an endocrinologist. And it turns out that Avery Sandberg, who was at Roswell Park, trained in hematology with Wintrobe at Utah.
Sure.
And also trained with, I think it was Leo Samuels, who was chairman of biochemistry at Utah, in endocrine biochemistry. And I'm not sure how he got interested in that. It had some relationship to some aspect of hematology that he was interested in. And he set up shop ultimately at Roswell Park with a PhD who had trained with him as well. And they became one of the leading molecular endocrinology groups in the country, published very extensively on estrogens and progesterone, cortisol. And I was recommended to work in his lab for this effort to try to develop an assay for aldosterone. And he was very generous, and he gave me a corner of his lab to do that work during the summer after my freshman year. And when I got scooped, he had me come back during all my elective time and summers to work with him on a project to biosynthesize estriol glucuronide, a carbon-14 labeled estrogen glucuronide. And that resulted in my first paper. But because he was a hematologist, he didn't practice hematology, but he was responsible for reading all the blood and marrow samples at the institute.
Okay.
And at the end of the day, when I left the lab, he would see me walking by, and he'd wave me in and say, sit down at this double-headed scope with him, and he'd quiz me on marrow cells. Well, I had no training in that.
Right, of course.
But over time, I became interested in diagnosis, hematopoiesis, and the fact that you could make your own pathological diagnosis
Excellent.
through microscopy.
So he pushed you into a fellowship? Did you actually do a fellowship in hematology?
Well, no. When
Right.
I finished with medical school, when I graduated from medical school, my father had died when I was in medical school, so I wanted to get away, but I didn't want to be too far from my mother, who needed some support. And Avery Sandberg recommended Rochester because the hematology group here was quite well known at that time and highly respected.
Excellent.
And Rochester also had a very attractive residency program in medicine. I came here in 1960. And so I decided to come to Rochester, and I completed my medical residency here. And then I had to do 2 years of government service, as was the case in those days.
Mm-hmm.
And I went into the public health service, and I was assigned to a project which sent me to the School of Public Health and the medical school at the University of North Carolina.
Okay.
They just completed a massive county survey of biracial population. They did a census on it, and all sorts of medical examinations and laboratory examinations in an effort to see why blacks in the community had a very high frequency of hypertension, much higher than whites, but seemed to have a lower frequency of myocardial infarction than the whites did. So they set up this study. They sent me to the School of Public Health to help analyze the data. I also, in effect, did a cardiology fellowship while I was there. But I intended to come back to Rochester to do my hematology fellowship. So I came back as chief resident in medicine, and from there went into hematology here and stayed really.
Did you do laboratory work as a hematology fellow?
Yes, I only had 6 months of clinical fellowship, and then I went in the lab under the auspices of a medical science training grant. The NIH set up a special program, and I was supported for 1 year. And during that year, I competed for a special postdoctoral fellowship from NIH, a 2-year award, and received that. And then, just as I was finishing those 2 years, I competed for a Leukemia Society Scholar Award, which I got, and that, along with that, I got my first NIH grant from the NCI. The Scholar Award helped with my salary, and the grant, of course, helped with my research costs and technology costs.
So you really described being in the laboratory from the time you were in college, with the exception perhaps at some time in North Carolina. You were really in the laboratory and seemed to have a love to return to the laboratory?
Yeah.
Which, do you think the fact that there is much less laboratory time now in college and frankly in medical school as well contributes to the fact that fewer physicians are becoming laboratory scientists?
I think that's part of it, but I think probably the most important piece is that when I was in the laboratory, the science we were doing was much more closely tied to the medical aspects of whatever one was studying. I can remember we had a very, very active cardiology research program here, but what they were doing was taking the measurements they did when they cathed patients to see what the degree of leakage of their mitral valve was and making those calculations, and that was research in those days. And I suspect the nephrologists, you would know better than I, were measuring glomerular filtration rates in different diseases. So it was much more closely tied to the clinical work. And in turn, the clinical responsibilities got much more intense, so much more requirements for quality assurance and other aspects of clinical medicine that made it very difficult to free up the time to do both and be trained properly to do both.
Right. You spoke of some people who influenced your career. Could you tell us about others who really influenced and directed your career?
Well, Avery Sandberg was very important because Avery let me go into the laboratory and express those interests during my the three summers of medical school and all my elective time. And then he also helped me select a hematology and internal medicine program. So he was very important. Then when I came here, Bob Weed, who became head of hematology while I was here, he succeeded Scott Swisher, who left to become chairman of medicine at another institution. And Bob let me go into his laboratory as a fellow. I had access to his technicians. I had access to a lot of sophisticated equipment that he had accumulated. And I took a slightly different path than he did. He was interested in red cell membranes. I became more interested in white cell membranes, consciously, because we wanted to expand the breadth of what was going on in the division in terms of research activities. But Bob was an extremely generous person in many ways. And then the third person I would mention was Asa Rothstein, who was then chairman of what was called radiation biology and biophysics, became later biophysics, and ultimately merged with biochemistry to become biochemistry and biophysics. And Asa was chairman of the department. He was a yeast geneticist who later moved on to mammalian cells. And he gave me a joint appointment, gave me some laboratory space so I could become somewhat more independent. And those three people, Sandberg, Weed, and Rothstein, were very influential in making it possible for me to do what I did.
Yeah, it's amazing the influence that senior people who are enthusiastic and great scientists can have.
Absolutely.
You spoke a bit about forging your own direction. Can you tell us what areas you principally worked on when you were younger and how that evolved?
Well, my initial interests were in biophysical and biochemical aspects of blood cell membranes. And initially, I studied the changes in the surface of blood cells as they matured in the marrow from primitive undifferentiated cells to mature neutrophils or monocytes. That was one aspect that we studied. I actually ranged pretty far and wide. In parallel, because the lab was also interested in red cell survival and biochemistry, especially organic phosphate compounds in red cells, I did some work on that and happened across a patient we were studying who, unbeknownst to us, had extremely low inorganic phosphate in the plasma because they were receiving hyperalimentation without supplementation. And we were studying his red cells, and I was measuring ATP using the luciferin luciferase assay and a scintillation counter to measure photons. And we got ATP levels that were lower than we'd ever discovered. I thought the scintillation counter had a problem. But we ultimately realized that this was the result of profound hypophosphatemia. And we went on to study that. In the process of studying organic phosphates, I became very interested because it was a very up-and-coming topic at the time in 2,3-dephosphoglycerate, oxygen hemoglobin affinity, and got supported for about almost 10 years by the Army because we had the idea that we could develop a drug that would reduce hemoglobin oxygen affinity, the net result being that there would be increased delivery, and the Army was interested because they wanted to put troops at the top of a mountain without their being at risk for mountain sickness.
Right. And
so we did a fair amount of work in that area.
if you were talking to your grandchildren and telling them about your biggest contributions to science, what would you tell them?
Well, some of them, it was hard for them to understand the impact. We studied calcium and transport in lymphocytes undergoing proliferation, both a mouse lymphoblast line and normal human lymphocytes, and characterized sodium, potassium, and calcium transport in these cells. At the time, there were a lot of misadventures in other labs. We thought mistakes were made for technical reasons, and we did a lot of work in those areas. Lymphocytes, proliferating lymphocytes, activated monocytes. We did work in hematopoiesis. We established the first cell line that produced conditioned medium that supported the growth of marrow cells in culture.
Really?
We tried to purify those growth factors. We were scooped because people cloned the gene for them while we were doing purification. Did a lot of other work in that area. But one of the things I think had real practical value is that when we were doing our work on 2,3-DPG and oxygen affinity, I developed an assay by which you could measure the P50 for oxyhemoglobin affinity using a single venous blood sample.
Really?
We developed an equation. It turns out that the PO2 in the venous blood is in the linear area of the oxyhemoglobin association curve. And so we could extrapolate using this equation to the curve, and it was used as a method of diagnosing high affinity hemoglobins. Those patients came in with polycythemia, otherwise unexplained, didn't have the features of polycythemia vera, didn't have other causes of secondary polycythemia, or people with low affinity hemoglobins who had anemia, and was used as a diagnostic test. And some scientists also used it to do epidemiologic studies at high altitude because it was so simple that they didn't have to have elaborate equipment to measure hemoglobin oxygen dissociation curves. So a lot of interesting work in South America, in the Andes and in the Tibetan mountains was done using this very simple method.
And again, speaking to how close your fundamental research was to the clinic. And
yes, in that case it was.
Somehow now we're a bit more separated.
Yes, absolutely.
That's fascinating. Over the years, I'm sure you've had many young people in the laboratory in various roles.
Indeed.
What kind of training did you provide to them, and how did your early influences impact how you trained the people?
Well, I had medical students who spent time with us, summers or elective periods. Mm-hmm. Then we had our hematology unit was always focused on research.
Sure.
And so we had research training grants throughout my time there, and our fellows, after a period of clinical training, would all go into the laboratory. Not all of them continue to pursue that, and so they, some subset of those worked with me in the lab, and then I supervised the research of 4 PhD students, one in microbiology and 3 in biophysics, who went on to very successful careers. One is now a professor of pathology at Harvard. He and I worked on lymphocyte calcium metabolism. One is a professor at Washington University. He's head of hematology in the transplant program there. He worked on this cell line that we developed and purification of growth factors. And one worked on calcium metabolism in monocytes, and he became a professor of orthopedics at Duke.
Okay.
So 3 very successful guys, and the fourth was a PhD, not MD, PhD, who went into college teaching. She did 3 really very good papers on the effect of cardiac glycosides on cell proliferation. We could never separate, even with molecular modification, the potential cardiotoxic effects from their anti-proliferative effects. But
so certainly 4 very successful trainees.
Yeah.
How about the other fellows who rotated through the lab and perhaps became clinical hematologists? Do you think the laboratory training impacted their ability to practice hematology or understand hematology?
Hematology is such a laboratory-based discipline that I think it did clearly enrich them. In addition, in those days, we were responsible for reading the blood and marrow.
Sure.
And so they were very well trained in that aspect of hematology. Now it's pretty much all been moved to pathology, which has a lot of positive features to that. But they had the good fortune of having a great deal of experience, which again made them able to perform better. And some of them did go on into an academic career.
Sure.
As well.
Right. So again, the close interaction of the laboratory and the clinic that we perhaps saw years ago and don't see perhaps as much today.
Absolutely.
Yeah.
Absolutely.
So what do you think, if you would really like to tell the young students today, the people going into science at many levels, not just the more the PhDs, but the younger people, even before that, should they start off in the lab? What should they do?
Well, I think young people, if you're talking about people who are in high school or college,
start there.
I think they would have to try to find a laboratory experience to see if it excites them, because if it doesn't excite them, if they're not really excited about it, it probably would not be the right path for them. So first, I think they should see if that excites them. Then ultimately, through college and maybe beyond into either a professional school or a graduate school, I think that they should pick an important problem and try to stick with it, because there's always more to learn. And I think for scientists, if you stay narrow but dig deeply, you're more likely to make substantial contributions. And the other thing is, I think, to find a senior person to work with, a mentor, if you will, who has not only achieved a great deal themselves, but who have the magnanimity to share that expertise with young people. Some very good scientists are not as good at that as others.
Yes.
So they should keep their eyes open in that regard.
Could you elaborate on asking the right question?
Asking the right question. Well, I think in the case of medicine, I think it can be very complicated. I mean, you want to ask a question that will provide some substantial benefit to humankind. It might be diagnostic, it might be therapeutic. It usually would be one of those aspects. It might be basic, it might be fundamental. Ultimately, that would lead to better diagnosis or therapy. I think the problem for the young scientists is that they have to work at a level that is very different from. We really worked at a physiological or a biochemical level. I think now one has to be a geneticist, an immunologist, and these are very complicated fields. And so I think it's important that they figure out what background they need to get the skills that they need to do the things that they want to do.
So would you recommend someone going into the laboratory really focus on an MD, PhD, as opposed to just an MD?
I think a lot of MD, PhDs don't go on to do high science. I don't know what the success rate is. It used to be around 50%. It might even be lower than this because the complexity of each discipline and the demand on your time is so much. I think that I think an MD PhD approach is a very good one, but ultimately they're going to have to move to one side or the other, I think, to really do anything meaningful. And so I think there's somewhat more of an argument today to be a PhD rather than an MD PhD, or an MD rather than an MD PhD. At least in terms of the broad scope of things. I think there are obviously individuals who can do an MD PhD and satisfy the ultimate goals of that is have a highly specialized practice and also do very sophisticated research, but I think it's getting more and more difficult.
Right, and perhaps why we have more team science.
Exactly.
Where the MDs can help the PhDs ask the clinically relevant question.
The corollary of that is that we have so many more PhDs in clinical departments now working with either physician scientists or physician academics, and I think that is a much more productive way to go for the average person.
Certainly in nephrology, that's true. Every one of our laboratories has a mix of MDs and PhDs, right. And they wouldn't be successful without that team science. So what else do you want people to know about your career, your approach to science, your training? What do you want to tell the people out there?
Well, I first would tell them that I am extremely grateful for several things. One is that I developed an interest in science, was able to pursue it. The other is that I had people who cared that I was successful and helped me along the way. And very gratifying experience. The other is I'm blessed with longevity. So I've been able to learn more, read more, study more, write more. And in my later years, when I became dean, I began to have to give up some of the hard science that I was doing and became involved in writing textbooks, and that's been very gratifying. So I think I've published 18 or so textbooks or monographs. One is in its 9th edition, hematology textbook. It goes deep into the discipline. And I've also, which is common, become more interested in the history of medicine, and so I've written a fair amount recently on the history of various aspects of hematologic disease.
So you again show us that curiosity about science, about history, is a key to really having an interest and sustaining a career. Is there anything else you'd like to tell us, Marshall?
No, except to thank you for taking the time to interview me. I really appreciate it, David.
Marshall, you have to understand, when I came here, you had just transitioned to dean, and I watched someone who had been a very eminent researcher move toward a more administrative role. And on one hand, I said, how could he leave the laboratory? But it's also a normal transition, and clearly you've excelled at everything you've done. Thank you, Marshall. It's a pleasure, and I hope the young people, especially the young people out there, can benefit from your wisdom and your thoughts of how to shape a career, because that's so critically important. Thank you, Marshall.
Thank you, David.
Hey, that was fun.